We're going to start our assessment from the front. So as we look at Amy from the front, we're going to look at symmetry between the left and right sides. So if you look here at Amy, you may notice that her right shoulder is a slightly bit higher than her left. It's real subtle, but it's a slightly bit higher. As we go down, we're going to take a look at her hips. So sometimes you can take your hands and run them down the side of the body until your hands rest on the top of their hip bone. And you may notice my right hand's just a teeny bit higher than my left hand. So that's another thing we might notice is the right shoulder's a little high and the right hip's a little high. So she's a little bit tilted up on the right side. As we go down, we're seeing that her hips look fairly symmetrical. There's no difference between the inside and the outside of the thighs too much, but as we come down, you may notice in the knees that the knees bow slightly outward. And this is happening because she has knee hyperextension. So it looks a little bit like her legs are bowed, but it's kind of a visual anomaly. And as once she engages her muscles, which we'll do later, that will kind of go away. But in a relaxed stance, she's putting pressure on the inside of her knees. If you go on down here and look at her feet, you may see that they turn slightly out, and there's a kind of a lifted position of the forefoot. We're going to see that more easily when we look at her side. So let's have Amy turn around and face behind. Let's turn all the way around. There we go. And once again, we're going to notice her posture from back. Here we're just going to look mostly at her shoulder blades. So in our assessment, we talked about looking at whether the shoulder blades were too high, too low, one forward or one back, tilted, or especially if they're too close together or too far apart. So here we still see that the right shoulder is a little higher, but here in the upper trap, it has a good slope. It may be a little bit flat, so we may want to think about that later, trying to lengthen that upper trap. If we go down here to the shoulder blades, I know you guys can't see, but you can feel where her shoulder blade starts. And it goes right here. And then you kind of walk your fingers back to the spine. And in our assessment, we talked about wanting the shoulder blades to be about 3 inches from the spine. So here, if you notice, this is where her right shoulder blade starts. It's a little bit more than 3 inches, and especially you notice it's further away than the left shoulder blade. So it looks like this right shoulder might be forward just a little bit, and also too far away from the spine. Also looking down here, you may feel a little bit of extra rounding in her thoracic spine. We'll see that more easily when we look at her from the side. Going down here, we notice the lumbar spine. And we go down the hips, and everything's looking pretty good. Then we go back to the knees, and once again, you may notice there's a little bit more space here, showing that the knees are kind of hyperextended, a little bit of genu varum. And then we notice that the feet are a little bit supinated, rolled out, creating a little bit more rigid base of support. So let's have Amy turn to the right. Usually from the side is where you're going to see a lot of information. So as we notice, Amy is standing in her most relaxed posture. And as she is, we're noticing her head is slightly forward. And if we look at her cervical spine, we notice an increased curve here and a more flattened curve here. So we really like to see less of a break between this part of her spine and her neck. So for a more smooth cervical spine. So we're going to note that. Here you can really see the forward shoulders, and everything adds together as everything is connected to everything else. So as her shoulder is forward, you're going to notice her spine is rounded. And this is showing us that she has increased rounding of the upper back, more than we would like to see. Going down, getting a nice picture of a little bit of malalignment with Amy. We're going to look at Amy from the side some more, and then we're going to go right into mountain pose. So imagine that you have a plumb line that starts at the center of the head, goes through the ear, and as you see my plumb line coming down, you can notice that the shoulder's in front, coming down the side of the body, and that the knee's slightly behind and the ankle's slightly behind. So that's a great tool to use to see if someone's out of their neutral alignment. Now as we go into mountain pose, she's going to roll her arms back, engage her feet, soften her knees slightly, lift the heart, and you're going to see that just with a cueing of mountain pose, someone comes almost into perfect alignment. She's doing the best that she can, and she's perfect as she is. So from here, we're going to join Amy and find a yoga practice.